Welcome to the special edition of Neurology News Network. I'm Marco Meglio. First up, patients with relapsing multiple sclerosis treated with 10 mg cladribine tablets were not found to be at greater risk of serious disease and/or serious outcomes when compared with the general population and the MS population. According to findings presented at the ACTRIMS Forum 2022, the post-approval safety profile of cladribine tablets is consistent with the previously published findings from the clinical development program. Data were collected as of July 15, 2021, with 316 COVID cases confirmed by tests and 51 cases designated as serious. An additional 6 patients with symptoms consistent with COVID-19 but were not further evaluated following reports of negative PCR tests. Of the 503 patients that were eligible to be evaluated, a total of 259, or 51.5%, had recovered or were recovering at the time of reported, and 3 patients with suspected COVID had died. Median time to onset of COVID infection from most recent cladribine tablet treatment course was 169 days for 314 evaluable patients. Next up, a recently published study looking at patient preference for early onset of preventive migraine treatments showed that both patients with chronic and episodic migraine treated with eptinezumab consider the likelihood of reduction of migraine on day 1 post-dose to be as important as their overall reductions in the first month of treatment. Primary investigator Jessica Alani, director of the MedStar Georgetown Headache Center, and colleagues analyzed a cohort of 101 patients who completed an online preference thresholding exercise. Based on responses to Choice Frame 1, 58% of participants with chronic migraine considered a 14% point reduction in the likelihood of having a migraine on day 1 post-dosing to have equivalent or greater value as a reduction of 2 migraine days during the first month of post-dosing. Furthermore, for these patients, a median reduction of 9% in the chance of migraine on day 1 post-dosing was also considered just as valuable as a reduction of 2 migraine days in the first month post-dosing. In the episodic migraine group, 51% of participants that responded to Choice 1 frame considered an 8% point reduction in the likelihood of migraine on day 1 post-dosing to be equivalent or greater value than reductions of 1 monthly migraine day. Lastly, although the benefits of mobile stroke units have been previously reported, a newly published large-scale meta-analysis showed that MSU use was associated with a 65% increase in the odds of excellent outcome, a higher proportion of treatment with intravenous thrombolysis, and 30-minute reduction to onset to IVT times without safety concerns. Studies from Medline, Cochrane Library, and Embase from 1960 to 2021 that compared MSU deployment and usual care for patients with suspected stroke were eligible for the analysis. Pooling 5 studies, including the notable Be Proud and Best MSU trials, the meta-analysis suggested that MSU was superior to usual care regarding excellent outcome in adjusted and crude analyses. Furthermore, the pooled odds ratio for reduced disability was 1.39 in adjusted analysis and 1.3 in unadjusted analysis, and the study authors wrote that the main strength of this review is the use of all published data with consistent findings across studies. For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.